Hey, my name is Kara. I'm an ultrasound tech, and let's talk today about how many scans that you can expect during pregnancy when you are having a normal, healthy pregnancy without any complications that arise during it. So, the short answer here in Canada is you can expect 2 to 3 scans in a normal pregnancy. The first scan is going to be what we call a dating scan. So, that is going to be the first scan that you get, and it is to basically see how far along you are in the pregnancy. We will hopefully see a fetal pole at this scan, and it is usually done between 7 to 10 weeks, is kind of like that ideal range. And during that scan, we are hopefully going to be able to see the gestational sac, the yolk sac, as well as baby, and also a positive fetal heart rate. During that scan, we measure baby from head to bum, which is called the crown rump length, and this will translate into a gestational age for how far along you are in the pregnancy. That is also how we calculate your estimated due date, and we also measure baby's fetal heart rate. Now, the second scan is one that is more on the optional side, and here in Canada, your doctor will give you a option of whether or not you want to get this second scan done. That is called the nuchal translucency ultrasound, which is done at around 12 weeks. You can think of the NT scan as a genetic screen. So essentially, you are going to go in for an ultrasound around 12 weeks, and we are going to see how much fluid is at the back of baby's neck during that time. We also measure baby again, take the fetal heart rate, and just check out baby's environment. But the most important part of that scan is going to be getting a measurement of the fluid at the back of baby's neck. Anything over 3 millimeters is considered abnormal where I work. And that, in combination with the blood work that you are going to get the same day, as well as assessing your background risk, is going to give you a risk factor as to whether or not baby has a genetic condition. So basically, a genetic abnormality. This is not going to be a definitive way to tell if there is any sort of chromosomal abnormality going on, but essentially it will tell you if the risk of baby having something abnormal in that sense will be elevated or not. So, as I said, this one is more on the optional end. I would say about half the patients that I see do opt for an NT exam, and it may be more recommended to you by your doctor if you have some risk factors going on or if you are having a baby and you are over the age of 35. And the third scan, which is arguably the most important scan of your whole pregnancy, if you're going to just pick one scan, is the anatomy ultrasound. That is usually done around 19 weeks, although it can be done between 18 and 22 weeks. And this is the scan where we are checking baby's anatomy from head to toe. We are checking everything from baby's brain to the heart to the spine to the limbs, and just making sure that everything is developing correctly and everything looks anatomically normal. It is at this scan as well that you can find out baby's gender if you would like, and we do also take measurements of baby at this scan as well and measure baby's fetal heart rate. We check the environment too, and we also ensure that your cervix is still nice and closed at this point, and we look at your fluid as well as your location of your placenta. So hopefully this has cleared some things up for you guys, and as always, I can only speak from my experience as someone who lives and works in Canada. And this is basically just going to be the standard amount of exams that is offered to patients here in Canada. Obviously, if there are any complications that occur during your pregnancy, or if there are any hiccups along the way, like let's just say you go in for your first ultrasound scan and you end up being earlier than 7 weeks, so therefore we need to order another scan in the first trimester just to be able to give you a correct due date. Or let's say in your third trimester, you end up measuring bigger or smaller than what is expected at the doctor's office, then you may also need a scan in the third trimester to be able to assess baby's growth. And the same kind of thing goes for if we find something abnormal in your second trimester scan, so that standard anatomy scan, then it may have to be followed up in the third trimester or another scan in the second trimester just to confirm that what we were seeing at that first scan was indeed accurate. And as a little side note, I know that I have a lot of patients telling me that it is really disappointing that they only get 2 to 3 scans during their whole pregnancy if they are having a normal, healthy pregnancy. But just remember, we always try and limit the exposure to ultrasound that we do on mom and baby. So the less scans you get is actually the better, because that means that there is nothing going on in your pregnancy. And basically, there have been no concerns in your pregnancy that have needed more than the standard amount of ultrasound scans. And in the end, that is actually a really good thing. And lastly, these standard scans might also be different depending on where you live. So although 2 to 3 scans is just standard for where I live, that doesn't necessarily mean that this is the end all be all for where you are. And in Canada, we try and limit the amount of scans as much as possible unless they are medically necessary. So that may also be a difference in why we have so few scans compared to other parts of the world. But in the end, we always try and limit exposure as much as we can, and that is something that I definitely stand by.